Hi lovelies, welcome back to my memoirs and a few pages from my diary. So this was a Friday and it started off as usual. I prepared the kids to go to school and I was midway doing my laundry when I received a call from my eldest daughter's teacher. So he told me that she was complaining of a headache and she wasn't really feeling well. So I had to rush to complete my laundry so that I could go and pick her up from school and take her to the dispensary. I had to do this on this particular day because here our dispensary opens only from Monday to Friday. Saturday and Sunday, it's a government institution, so it's usually closed. So I had to make sure that by the end of the day, I had to take her to hospital to get some drugs so that it can see us through the weekend, and hopefully by next week on Monday she would be feeling a bit better to go back to school. Two of my daughters go to the same school here in Karimboni, that's Karimboni Primary, and I did not see why I should pick only one and leave the other because the school is quite far from where we stay, and they usually use a motorbike in the morning and a motorbike in the evening. So I decided to take both of them from school, and I told myself I was just going to ask permission to take my second daughter together with my first. Then we'll both go to the hospital and call it a day, come back home so that I don't spend twice on the motorbike. Healthcare here is not as we don't have much variety when it comes to hospital. We only have one dispensary, which is the Karimboni dispensary. It is government funded and it is a very small dispensary. It doesn't deal with the chronic illnesses or chronic cases. If such an incident is to occur, then somebody has to be referred to maybe a bigger hospital. I have not seen private practice from around this place, and as far as I know now, we don't even have a chemist. So the dispensary is what delivers everything from treatment to medicine to the drugs, etc. Hubby has type 2 diabetes, and there was a time he ran out of his drugs because when we were in Mombasa, I had a medical cover from my former place of work. So that's where he used to source his medication. So when we came here and I had resigned, we didn't have an option but to buy drugs, and we wanted to see whether Karimboni dispensary has that. So unfortunately they don't have drugs for hypertension or diabetes, all these chronic illnesses. They just do the basics. So if you I think family planning issues, antenatal, prenatal clinics, small illnesses here and there, the flus and the coughs, maybe dressings of small wounds, but things to do with x-rays and stuff, they do not deal with that. So that's kind of a down, what do you say, kind of a disadvantage because of no variety. So all in all, it serves the basic small cases that takes people to hospital. And I don't know if maybe in the coming days or months or years, maybe somebody should open a private practice, or maybe they should open a bigger government institute to handle such cases, because this place is very far from Malindi. So you can imagine if you have an emergency and you're referred all the way to Malindi for the bigger hospitals, and it just gets a bit complicated. So that's what I've realized since we moved here. I had planned to walk all the way to school and then come back with the girls. Take the girls to hospital, then come back with a motorbike. But Lady Luck smiled down at me, and our normal motorbike guy, I met him on the way and he gave me a lift. So I took the girls to, this is me after picking the girls from school, and this is Karimboni dispensary. So it's a very simple process. You need to have an exercise book or a notebook that is like your, what do you call it, your card. Yeah, basically that's just your card. You present it here at this station where the book is taken to the doctor who is inside. So once your turn comes, the doctor calls your name, then you go see the doctor, explain yourself, and after that you're given a prescription in your book. That's where they're going to record everything. Then you take the book back to this first station, and then you're given your drugs, because this one serves as a pharmacy too. This right here is Mr. Bandiko. Mr. Bandiko is very, very friendly, very social, very talkative. The first time I met him was when I brought my younger son. He had an injury. I'll explain that later on in the video. But I realized that not all government institutions have these irritating, guys as attendants. This guy, he actually loves his job, and I think it's just worth mentioning. And here we are with our drugs. It was very quick because the place was very empty, as you can see. So we were just in and out in a few minutes and we were done. And it was time for us to go back home. Now, I quit my job because it had so many issues. So those are very many topics that I need to address or maybe discuss and share later on. But the one thing that I really truly miss about my place of work was the medical cover. We had a very, very nice package, and honestly, you don't realize you have something until it's gone. Now that I'm back to using public health and this kind of facilities, this is where I realized, Maze, I had a good thing going. Our inpatient was 200k. No, outpatient, was 200k, and inpatient was 1.5 m. And it came really in handy when I had to do CSs for my third and fourth born. I did not spend a single shilling. And the kind of services that we received, it's private. No offense, or no, I'm not really fighting government institutions, but there's just that kind of reception that you get where money is spent. Those who don't know. So I really, really miss that, and I would want to be I'm wishing for God to place me in a position where I can be able to provide that for my family again. Our first experience with this dispensary happened when my youngest son had an accident. He sprained his ankle, He was riding a bike with our eldest son. Then they fell down and his leg got trapped in between the spikes of the bicycle wheel. So that led him to sprain his ankle. It was a very long night. It happened on a Thursday evening. Remember, the dispensary doesn't work beyond 5. They're not open beyond 5 p.m. So we had to sleep through the night. It was a very, very long, frustrating, stressing night because my son was in pain. We were very broke. We could not even afford to take him to the nearest dispensary or hospital, which is very far away. So we just had to sleep through the night and wait for the morning. So meanwhile, I gave him some painkillers, which kind of helped him through the night. Then early in the morning, we had to take him to the dispensary. So this was a wound, and I had to take him to hospital 3 times a week: Monday, Wednesday, and Friday for dressing. And remember, there was we were very broke at that time. Hubby had not even started working with the car. So there were moments where actually every day I would tie him on my back and I would walk from home to the dispensary and back. So this eventually could go on for around 7 weeks. I think it took 7 weeks because it became a very deep wound. The images are very graphic, so I don't think I'm going to share how the wound became because it started digging into the flesh. I don't know how that happened. Either way, we got the help we received. We got some medication. It was all free. And eventually, after around 7 weeks, my son could at least start walking, and it was finally a relief. It was a relief. The last time I went to that dispensary on the last day, I just thanked God because it was very, very tiring. That was enough exercise for me to last a whole year. With that said and done, I think moving forward, I need to invest or have a small first aid kit and a medical cabinet where I need to stock up on the basic drugs that one needs to have around the house: the paracetamols, the antihistamines, the antifungal creams, antibacterials, that kind of stuff. That is something that I need to at least have because I've come to realize they come in handy, especially now we are off-grid and we live far away from where our nearest dispensary is. So currently my daughter is doing well. She has resumed her classes in school. My youngest is also okay. It's up and running. This happened the beginning of the year. Yes, but I'm grateful that he's now okay and we have learned from those experiences. So with that, my dears, let me close this vlog here. Thank you so much for sticking around. Please like, please share, please subscribe, please comment, and let us meet in the next one. Bye.